Guys, welcome to our video. Kindly, you guys, if you have not subscribed to our video, if you have not subscribed to our channel, Future Talks is your channel. Kindly, I want to appreciate for those who are supporting us and also those who keep coming back. I know we have new subscribers in here. This Future Talks channel, where we get to talk about matters medical, where we give our stories the African perspective, and also get you entertained and also informed at the same time, so that we make this world a better place to live in. It is what it is, guys. Today we want to talk about halitosis. Halitosis looks technical. Halitosis, so uh, uh, it looks technical, but it's very simple. What I mean is about bad breath, especially I'm talking about people. If you have a bad breath, or if you have ever experienced that bad breath from another person. Uh, we've been in schools, especially in primary. Here in Africa, we call them primary, secondary, college, or university, and we always have that classmate who has a bad breath. For me, I've had that in primary. In secondary, I used to have a friend there who used to have that bad breath. In college, there's that one guy who was always unique with the breath. At workplace, I don't know. You tell me. But halitosis, or bad breath, is a common condition which is caused by various factors. And today I want to share with you the commonest uh, causes of that bad breath. Yeah, so one of the things which is very common, which can cause a bad breath. What do you guess, guys? Anyone who can make a wild guess? Uh, the most common cause of that bad breath is actually what we call bad or poor oral hygiene. It can be the main cause of this problem, like brushing and 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 flossing. Brushing with the brush we use to clean our mouths with, the toothbrush. Yeah, and also we have a special thing called flossing, because when you brush, there are maybe some food sediments which remain in our mouth or within the gums of the teeth. Sediments out is actually through what we call flossing. Flossing helps to bring out those food sediments. If you have gone to a dentist, actually I never knew about this flossing thing till recently, when my dentist did something on my tooth, and there is something like a string which they do to remove or to open the gums. And actually, well, because brushing only is not enough, so it's very important that you get to know what flossing is, because if those food sediments remain within the mouth and also the teeth gums, when they rot, they get to a smelly state, which is not very interesting. So when there is poor oral hygiene of the brushing and also flossing, you get into that bad breath. Another cause of the halitosis or the bad breath is what you call the gum disease. Uh, Gum disease caused by which can cause now the unpleasant odor in the mouth. So normally with the gum disease, and it's very common, we have those people with their bleeding gums and with uh, other issues with the mouth. So it gets into that smelly state. But there is always also approach on how to manage that one. Another cause of The halitosis, or the bad breath, is what we call dry mouth. That is when one lacks saliva in the mouth, so it can lead to halitosis. Especially though for those patients, especially the stroke patients, especially those patients who are bedridden for a long time, people who are very sick, you get that they have, most of the time they have a dry mouth. That's why it's always recommended that those people with a stroke, they be done daily cleaning of the mouth, what we call oral hygiene, so that they can get it very well. You can also experience when you have not taken like water for a long period of time, like in a day, maybe you were in a meeting and now there was no water, you've not taken water, maybe you are busy doing some procedure somewhere and you have not taken water, your mouth is dry. Normally it smells at that particular point because it leaves some bacteria to grow in the mouth, and also you get into that kind of dry mouth. So it is recommended that you're drinking plenty of water, and also chewing food-free, sugar-free gums. Chewing sugar-free gum can help increase the saliva in the mouth, so that now you don't get into your mouth dry. It's also recommended for especially those patients who have a stroke, which is not very severe, and they are able to chew. Most of the time, they are given actually something those sugar-free gums to always make salivation, also produce some saliva in the mouth, so that the mouth doesn't become so dry. Another cause of bad breath is very common, and also the common cause is smoking and the tobacco use. So because smoking and tobacco can cause a strong odor in the mouth, so quitting tobacco and also the smoking can help to improve the breath or the odor. Also, we have people who have certain kind of foods which have been also been associated with the bad odor, especially those foods like certain drinks and drinks. I talked of garlic, coffee. Though they can cause that bad breath, but it's normally temporary. So garlic is very healthy to take. Uh, Coffee, not in excess, is healthy to take. So you check on your you check. We always want to check on how we take them, so that do not become a problem at the end of the day, and also predispose us to other problems at the end of the day. So especially, and also the spicy foods also can also be a main cause of that bad odor. Some medical conditions also can cause bad breath or halitosis. When I talk of medical conditions, I mean like things like sinus infections. Sinus are in the inside the nose. So if there is an infection there, because most of the time can't get there to clean them, so they can cause that bad breath when one gets to breathe, especially also other respiratory infections uh, can also cause such kind of things, especially if one has things like also tonsillitis. They can also have that bad breath at the same time, because also they affect the breathing, so the breathing problems. We have also people who have things like acid reflux. This is where one gets to regurgitate a lot from the stomach, because of the system of the stomach doesn't close very well, so they have also acid reflux. Yeah, so there's a lot of some very bitter water coming out of the stomach, especially after feeding or without feeding. So such kind of people can develop the reflux and cause the halitosis. So very important. So that is determined by a doctor when one has that problem. If it is acid reflux, there's a way doctors give medication for it, and at some point also there's a surgical management of the same. But most of the time is the drugs, and boom, something is done, and also the patient gets to get into the proper working condition so that they can work very well, very well. So most of these things are determined by the doctor and also managed very well. So I have some examples of how the treatment is done for these patients. What for the most obvious one, like I talked about, is about oral hygiene, proper oral hygiene, brushing and flossing, as well as we also have special mouthwash where one can we have special liquids where one rinses the mouth, and the problem is easily handled, and also solved for the period for the patients. We also have professional cleaning, especially with the dentists, and also we have other places, people call them dental hygienists, who can help in managing this problem at that particular point. So here in Africa, especially in Kenya, it's recommended like you see your dentist once a year. It's very important to check even if you are well, even if you are not, even if you are not sick. It's very important to see to check on your dentist. But when you have this problem, always adhere to the guidelines and also with the date given by your dentist, so that you get to manage your problem on this dental issue. Another thing is about treatment of the gum disease. We found out that gum disease can cause halitosis or bad breath. So it's if gum disease is the underlying condition, it is approached and it's treated very well, so that the patient now gets now you get your good breath back when the gums get well through the treatment with antibiotics and other cleaning. We have special cleaning, and also you are taught on how oral hygiene according to your problem of the gums, so that you get that help from your doctor. So in some cases also you get to get into antibiotics, which can help you get well, and also get to manage you get to manage yourself very well. Another thing which happens is what we call saliva stimulation. I've talked about taking plenty of water. If your doctor finds out especially that your mouth is always dry, it's recommended, the natural way is to take a lot of water. Yeah, you take a lot of water. Water is very important for body hydration, but at the same time also it makes our mouth not to go dry, because when it goes dry we get to develop that bad breath. So water is very important. And also about the sugar-free gum, uh, chewing is very important. Like I said, those people with mild stroke, they are really encouraged to take some chewing, because when someone has a stroke, the normal way of working of the mouth is affected, so they are advised over the same. And this factor of water and also the chewing the sugar-free gum is to stimulate the salivation, to keep our mouth wet, because our mouth are supposed to be wet with saliva, and saliva protects us from other bacteria, and it has some enzymes which also have a special function in our mouth to keep it in the normal condition like another organ. It is a neglected part of it about the oral hygiene, but it's very important about keeping our mouth always salivated, so that we get protected from other infections, and also keep our breath fresh, so that we don't get that embarrassment of having that bad breath or the halitosis. So another thing, we found out that tobacco and smoking is one of the cause of the bad breath. So we want you to get out of smoking and also tobacco, so that you get that improve your breath odor around. Also, we have the treatment options for this condition, especially with sinus infection, respiratory infection, acid reflux. So the underlying condition is treated, and the problem for the halitosis is completely now solved. So another thing is about dietary changes. We found out that some spicy, highly spiced foods can cause bad breath, and if you are a victim of the same, so you're advised to go down on them or reduce them. And also things like garlic and coffee, yeah, they are good, but you go down on them so that you may improve the odor of the mouth. So what are the complications of halitosis or bad breath? Obvious social and emotional impact. You get that bad breath can cause social and emotional discomfort. When one knows that he has or she has a bad breath, so it becomes an embarrassment, and the people practice such kind of people. If people want to tell them about their condition, or the people know about their condition, they want to isolate themselves from others, and it can lead to depression. Another complication which may come out is poor oral health. So because it may be a sign of gum disease. If it is there for a long time and left untreated, the condition can lead to the tooth decay, and also you get to lose your oral health. So it can, if not well attended to, because it's like a thing like a gum disease, and you get that your tooth is going to get out, and also you get more into other problems. So it's very important that they get treated early. If you don't get treated them, now you have a problem with your mouth, and also your teeth, and also your tongue, and other issues with the mouth, which cannot be very interesting, and also cannot be very good at some point, but preventable most of the time. Infections can come up as a complication of bad breath in rare cases. If someone has abscesses, infection in the sinuses or the lungs, if untreated, this can become life-threatening to the patient. Things like acid reflux may look very simple, but if not approached very well, can complicate to other problems, and also bring a lot of issues to the problem to the patient. So because that acid reflux, because that is we know we have a special acid in the stomach, which helps in protecting the stomach and also helps in the digestion. But when it gets out of the stomach and you reflux, meaning it comes back to the mouth, it gets to burn the esophagus, and now that one leads to other problems which were not even anticipated for the same. So it's very important to see your doctor on what is happening, and also find out the proper solution for it, because the problem may be the bad breath in the mouth, but the other problems, there can be problems in the lungs, there can be problems in your breathing system, there may be the problem in the nose, the sinuses, like I mentioned, which needs to be approached at that particular point, so that the patient gets the best the treatment which they can always get. Guys, welcome to our channel. This channel is Future Talks. Kindly, if you have not subscribed, subscribe down below, give us a nice comment, and guys, welcome to our next video. Thank you very much, and peace.